the whole world is completely moving towards precision diagnosis, where another 2 decades will be witnessing the whole world will be in the personalized medicine, that precision medicine. Because as WHO has warned developing countries like India, prepare yourself for combating non-communicable diseases. 3-4 years ago, we faced a huge pandemic where everyone is running pillar to post to get the beds for the treating. We lost a lot of people due to lack of oxygen and lack of bed strength in the hospital. If bed strength would have been there, you would have saved a lot of people during COVID. The same thing WHO is warning developing countries like India, where we are facing a lot of non-communicable diseases. We'll be in 2020 to 2050. It is alarming that every country is developing state will face huge issues like COVID. They'll be running short of beds. So be prepared with the infrastructure, build more hospitals, train more professionals, specifically medical and paramedical professionals, to cater the health crisis which will be faced in 2050. Because today, when we see the diagnosis of the diabetic, at the age of 25, before 2025 or 25 to 30, huge are becoming diabetic. When these people, in spite of good control, they develop kidney failure at the age of 50. At the age of 50, another 20-25 years, we need lot of diagnosis, we need lot of people to be into the dialysis. So WHO is thinking in that way. In 2050, huge people will be running for dialysis because your health is not proper. So precursing, anticipating those things, it is advising the developing countries like us to promote more into things. So combat NCD. So we have, as a traditional system of medicine, we are having a huge role in working with NCDs. So of course, communicable diseases, modern medicine people are there, their duty is to produce vaccination and combat it. But being a traditional system of medicine with different specialties we have it, it's our duty to focus more on non-communicable diseases where we can able to save the patients from getting into the primary prevention, secondary prevention, and even in the tertiary prevention. So they are balancing the Vada dosham, Pitta dosham, Kapha dosham, and there is a core concept of Siddha physiology, and balancing the dosha. Apart from that, there is the foundations of Siddha principles. How that, based on the Prakriti, we are addressing the patients. It is not that when a person is coming to the clinic, complaining, just hearing the complaints, and based on the complaints, if he is in diabetic, there is a set of asanas which can be given to him. It was olden days. But today, as the world grows, we are treating the patients based on the Prakriti. Same person, 3 people are coming here for diabetic, 3 are diabetic for past 10 years. But these 3 have different Prakriti. Some may be Vada, some may be Pitta, and some may be Kapha. Based on that, based on the Prakriti, Vada, Pitta, Kapham, based on Trigunas, Sattva, Rajas, and Tamas, based on the combination of these 3, we give practices. We design the practice accordingly. So we have developed a tool for it, and based on the tool, we assess them. Once the assessment is done, then it's time to prepare with practices, and we could see precise results and early results. We can able to see them. That will be discussed in the later stages. So, and let me just put in that way. So all slides see the same thing. So tailored practices. So every system, every person, based on their constitutions, we have a tailored practices. One size doesn't fit for all. One medicine is not fit for everyone. So every patient is unique, and every patient needs a tailored practices, that is called precision yoga therapy. So shifting to precision medicine, how the world is shifting towards the precision medicines like pharmacogenomics. It's high time that yoga too has such a kind of a thing that can be done in that way. And correcting the energy at the subtler levels by practicing the meditation spirituality, we can able to do that. And integrating the diet. So today medicine alone is not enough for practicing. That's why we have different specialities. Like for example, for modern medicine, if a person meets a modern medical doctor, he just treats you with simple medicines. And all other things, you have to go for other pattern. Like for example, if you want to go meet a dietitian, you can go meet them. If you want to go for a lifestyle correction, you have to meet different people. But in Siddha, all the system is secured by you. You are a diet counselor, you are a physician, you are a yoga therapist, you are a hormone expert, you are lifestyle modification specialist. So everything is asking you. It's high time you have to differentiate which is need for a person. Like for example, if a person is coming to my clinic, I assess them with these tools and then I prescribe medicines. Medicine alone is not working today because different reasons, different ways they are getting disease.